How does Mingle Health recommend addressing the challenges of the APM Performance Pathway, that is the APP, and ensuring compliance?
Great question, Susan. I think there are two principal driving forces determining whether or not you meet the APP challenge and qualify to collect your shared savings. The first factor is participant practices. I think that effective participation in your ACO's APP efforts should be addressed contractually. Performance, recoverable documentation, and data delivery should be either rewarded for success or punished when substandard or both. And I think having some kind of requirement or expectation, ultimately with a threat of dismissal from the group, is important to make this work. Second is data aggregation. You have to be able to collect and aggregate data from all of your participants. Now, the first factor was a cooperation factor. The second is more of a technical and procedural factor. That includes appropriate patient identification and deduplication of patients across practices. So you know that John Smith in practice 1 is the same John Smith in 2 and 3 and 4, and et cetera. The critical decisions here include how you'll do it, what vendor will help you do it, and the question, is it replicable and scalable as your ACO evolves? Expect that over time, you're going to add practices and providers, lose practices and providers, and see turnover in each practice's choice of the critical technology, including EHR, that is electronic health records, and practice management systems, and potentially the availability or lack thereof of an enterprise master patient index to give you an important key across these organizations. Now, if you're a frequent participation in this series of Ask Dr. Mingle, you will know that I recommend MIPS CQMs, or now the Medicare CQMs, from a qualified registry rather than ECQMs. The ECQM processes are just too rigid and too fragile to accommodate all participants in most ACOs, and most are susceptible to failure with even small changes in your technical environment. So with the expected addition, subtraction of practices, change or turnover in critical technology, even the routine upgrade of that technology, any of those things can render the typical technical only ECQM type of approach susceptible to breakdown and major maintenance requirements every year. Thanks, Susan. Great question.